Hi, everybody. We are back talking about medications and specifically an article that I wrote called 10 Tips to Manage Medication for Elderly Parents. Medications are so important. I think that sometimes we underestimate the importance that one little pill can make on our life, both good and both bad relative to the side effects. We're going to talk about a long list of things to help you manage medications for your elderly parents. So stay with me for this interesting webinar. I am Pamela D Wilson. I am your host, your presenter for this webinar. Let's get started with the normal housekeeping tips that I always offer. By now, I'm sure that you can almost recite these on your own. I use the term elderly parent or elderly parents for the person for whom you provide care. The outline for this module is in the course materials. Print the slide handouts, follow along with me, fill in the blanks on the slides. At the end of medications, chronic disease, and nutrition, you will be able to add to your toolbox and recite 10 actions to manage medications for elderly parents. You'll be able to implement a process to ask questions to manage health and produce positive results, and to learn how to better advocate with the healthcare system, which includes not only doctors, but your health insurance plan or your company and pharmacists. So let's talk about medications and the body. There's this neat little infographic at the left that was done by a company called Pillsy, and I'll include some of those statistics as we go through this. Your elderly parents likely take one or more prescription medications. One of the main issues for all consumers is not taking medications as prescribed. Why on earth would we do that? There's a medical speak term for that called medication adherence. Medication non-adherence results in, according to this slide, 125,000 unnecessary deaths each year. That's a lot. 66% of Americans don't take medications as prescribed. Not taking medications as specified results in over $300 billion of avoidable cost to the healthcare system. Consumer behavior to follow or not follow recommendations, take medications, and embrace healthy lifestyles represents the most significant cost to the U.S. healthcare system. So if any of you were watching TV during the coronavirus, you saw some pretty significant numbers. But if you compare those virus numbers to this number of non-medication adherence, it's amazing how we talk about the coronavirus, yet so many people die from not taking medications correctly, but we don't talk about it. $300 billion in cost. That's a lot of money. 66% Americans not participating. That's a lot of people. If we could only increase the number of people that cared about their health enough, we could reduce these numbers and we could reduce so many other numbers. What is it about a virus that gets people to pay attention? And what is it about things like this that people don't pay attention to? It's because it's not relevant, it's not in the news, and we're not talking about it. We should talk about health much more than we do. Prescription medications have different effects on the body. Some medications can decrease the appetite. Drugs and supplement side effects include a change of taste and smell, nausea, stomach upset, constipation, skin rashes, diarrhea, dizziness, drowsiness, dry mouth, headaches, insomnia, abnormal heartbeat, and cramps. So many side effects. Some medications to treat other conditions like depression can worsen the condition. Some depression medications can result in a decreased ability to initiate tasks, more considerable apathy, which is that feeling of, oh, I don't care about that, and low motivation to participate in self-care. The best way to confirm if medications are changing taste or smell or might be causing nausea is to talk about these potential concerns with a pharmacist and a doctor. Pharmacists can offer a wealth of information about medications and side effects. They are a very underused resource. Make sure that you watch for side effects each time a medication is added or changed for yourself or an elderly parent. The aging body responds differently to drugs that can pose very adverse effects on daily abilities. Here are a few classes of medications that can result in changes in appetite and mood changes, and you'll want to get out your pen so that you can write these down. Antibiotics for infections, diuretics that reduce fluid buildup in the body, certain heart medications, migraine medications, antidepressants, muscle relaxants, statins, which are medication for high cholesterol, and thyroid medication. Some medications also can result in dry mouth or being more thirsty. Those medications include asthma medications, high blood pressure, high cholesterol, statins, pain medications, anxiety, depression, Parkinson's, and Alzheimer's disease. Let's talk about a few tips to manage medications for elderly parents. And I want to look at the slide that says self-reported reasons for non-adherence, which means why on earth aren't we taking our medications? We'll go through some of the percentages in just a minute, but 63% of people forget. 29%, it's too difficult. 10%, too expensive. 5.3%, it's got side effects that I don't like, but I don't ask my doctor to give me something else. That's our job. And then about 5% think, I don't need this. I don't need to take this. It's not going to help me. Medications in the elderly can result in health improvements, but they also can have the opposite effect. They can have extensive adverse side effects. So the reasons that consumers fail to take medications are definitely reasonable, but we have to be proactive and think about the long-term effects of chronic disease. When we think about the fact that high blood pressure could cause us to have a heart attack, need bypass surgery, cause a stroke, cause dementia, cause kidney disease, then maybe taking that little pill makes sense. But when we don't know about the consequences, when it's not relevant, we don't do it. It's easy to see in the numbers. So let's talk about 10 tips for managing medications for elderly parents. Plus, I want to mention a Caring Generation podcast that reinforces this information. The podcast has a special guest, Dr. Neha Jain. She's a geriatric psychiatrist from the University of Connecticut Health System who talks specifically about medications in the elderly. You can listen firsthand. You can read the podcast transcript on my website. You can share it with your elderly parents. It is a great podcast that reinforces the subject of taking medications. So let's start with doctor appointments. You attend a doctor appointment with your elderly parent. You have a thorough discussion about medications because you want to know why each medication is prescribed and what it does. Based on my experience, this normally doesn't happen. Your elderly parent goes to the doctor writes a prescription. Your parent may or may not have it filled. They may or may not take it. They may forget to take it. They may stop taking the medication because they don't feel it's doing any good. In some situations, as we talked, your elderly parent worries about the copay. Nothing ever happens. So the question is, how much of this filling or not filling, starting, stopping, not continuing to take medications could be managed if we ask the doctor to explain the condition and the consequences of not taking that drug? What if the doctor explained the consequences of, you don't feel good today? Do you want to keep feeling like this, and do you want to feel worse? Or would you like to feel better? This pill can help you feel better. It can help you do more things. It can help you stay at home. It can help you not need as much help from your children who are the caregivers. It can make them feel less stressed about caring for you. We really have to talk about consequences to make medications relevant. The other question to ask is the condition temporary or long-term? Ask if the condition for which the medication is prescribed is temporary or long-term. Is there an alternative to taking the medication? Being practical is an approach to health that can lead us to ask thoughtful questions and be more informed about the health concerns of elderly parents, especially if learning how to manage medications for elderly parents is one of your caregiving responsibilities. Here's a typical example. Cholesterol medication is recommended. Ask about the alternatives. Might cholesterol readings come in range if an elderly parent changes diet? What does that mean? Does it mean eating more oatmeal, avoiding fried and fatty foods? If an elderly parent is set in his or her ways and would rather take a pill, then ask the next question. What are the long-term consequences and effects of high cholesterol, even if I take a pill, so that I'm aware and mom or dad is aware of the risks and future implications of high cholesterol? You're the caregiver. The health concerns of your elderly parent will end up being your concerns. The worsening health conditions of your elderly parents, they're going to end up in your lap, on your schedule, consuming your time. High cholesterol results in additional heart problems, clogged arteries that may require stents or bypass surgery. The likelihood of a stroke may increase. Chronic conditions for which medications are prescribed, they have serious long-term negative effects that are not routinely mentioned by doctors unless you ask question after question after question. If you're going to learn how to manage medications for elderly parents, having a thorough understanding of the health condition and the long-term effects is important to you. It's also important to your elderly parent and the time that you're going to have to commit in the future to caregiving activities. I want to talk about dosing because this is an important but very under-discussed topic. If your elderly parent takes a medication, ask about the dosage. So the dosage is, for example, like 10 milligrams, 20, 25. The question you want to ask is, what dose of the medication is required to have an effect? For example, one medication might begin at 25 milligrams and over time be increased to 200 milligrams. How do you know when you or an elderly parent have the right dosage? Another practical consideration that physicians fail to consider all the time is the physician prescribing a whole pill or a whole pill that has to be cut in half? If you can imagine a pill that's 25 milligrams that the prescription says take 12.5, which is half of a pill. You have to cut that pill in half. Half of that pill may be crumbled. You may throw it out. Pill cutting is complicated for elderly parents. Then who's cutting that pill? Is it you or your elderly parents whose hands are affected by arthritis? They can barely even pick up these pills or work with a pill cutter. Half the time they'll try to use a knife. They'll end up cutting their finger. This little detail causes so many problems and so many unintentional injuries. Talk about these details. They may seem to be a little excessive or overkill until you find yourself being that person who has to take the time week in and week out to cut those pills in half. It can be a huge, huge hassle. I want to take a minute to talk about side effects because all of us as we age can become more sensitive to any type of medication and any type of medication supplement. Anytime you take a medication, always ask your doctor about side effects. The problem is all medications have side effects. So how do you know which ones you pay attention to and which ones you don't? It's kind of a trial and error system. For example, I am very sensitive to pain medications. I didn't learn this until many years ago when I was a runner and I had orthoscopic surgery in my right knee. The doctor prescribed Tylenol with codeine and Vicodin. Those two medications, so nauseated, couldn't even get off the couch. Bad experience. I cannot take anything that is a strong pain medication. So we learn from, unfortunately, experiencing the side effects. But the good deal is we can relate those side effects then to other classes of medication. So side effects, very important subject to discuss with your physician. So anytime something's prescribed, again, you want to ask about the side effects of the medication. What signs might your elderly parent notice in their day-to-day health that would be different? For example, a side effect of cholesterol or some heart medications is leg cramps, and I mean severe leg cramps from the depletion of potassium in the body. Half the time, your doctor isn't even going to talk to you about this because it's such a small percentage. But if it happens to you, you're in that bad percentage who's having a side effect. Other people may experience thirst or dry mouth, skin rash, constipation, loose stools, stomach upset, dizziness, and headaches. If you don't ask the question about side effects, you may place your parent in a small percentage of people who have various serious side effects, and you don't realize that it's the medication causing that side effect. It's better to know upfront the worst case side effects so that these can be noticed and reported immediately to the doctor. The positive effect, though, is your elderly parent feeling better. Negative and positive side effects are important to monitor when learning how to manage medications for elderly parents. And don't blame your doctors for side effects. It really is an individual situation. It's a trial and error situation. If you don't try it, you won't know, and you may be pleasantly surprised by the positive effects. The same thing goes for what is called contraindications. What is a contraindication? A contraindication is medical speak for a situation where a drug, a procedure, or a surgery should not be used because it may be harmful to a person. A relative contraindication means that the benefits of using two drugs or two procedures together may outweigh the risks. Absolute means the drug or procedure can be life-threatening and should be avoided. So in the early stages when they were investigating the coronavirus, there was an old malaria drug and a Z-Pak, which is an antibiotic. And there was a lot of hope that this could be a treatment for the coronavirus. And it was actually tried and tested to be successful in many patients, but these two drugs would fall in that idea of a relative contraindication because using those two drugs together might outweigh the risks. And in this case, it was for people who the virus had progressed to such a severe state that the risk was death. So they were asking patients, would you rather just die from this, or would you rather try these medications that may or may not be able to help you? They helped a lot of people. When you're talking to your doctor about contraindications, ask if there are foods, medications, or other over-the-counter products that may make the medication less effective. When managing medications for elderly parents, you also want to let the doctor know every medication and over-the-counter supplement that your elderly parent takes, don't leave any out. Some foods and over-the-counter supplements make medications less effective, so the doctor may need to increase the dosage. Here's another example of a contraindication. Person who takes Coumadin, that is for blood thinning, should avoid grapefruit juice and foods high in vitamin K, like green tea, spinach, and green leafy vegetables, because these have a very strong effect on the level of that medication in the body. And people who take Coumadin, many times they have to do what are called finger sticks, INRs, to get the level of that Coumadin in the body. And if you don't tell your doctor that you're eating these foods or drinking these juices, your levels can be all over the place, and the doctor's wondering what you're doing. It's a food issue. It's a drinking issue. For other medications, calcium in dairy products blocks the ability of the medication to be absorbed into the body. If you're going to take a medication, you want it to work. Make sure you ask the right questions. Another very, very important idea is adding and discontinuing medications. When managing medications for yourself or an elderly parent, sometimes you might go to the doctor and you might get 3 or 4 prescriptions. If you know that you are sensitive to taking any type of medication, agree to add or discontinue only one of those medications at a time. Ask your doctor to prioritize and say, if I'm going to take one of these 3, which is first, which is second, which is third? Because you want to address your health issue, but you don't want to create other issues. Adding multiple medications at the same time stops you from knowing which medication might be giving a positive or negative side effect. If you try one at a time, you know for sure. Same thing if a medication is discontinued. Ask the physician if there is a time frame that it takes for that medication to clear the body before you replace that medication with another medication. Age, metabolism, weight, and health conditions affect the ability of our bodies to clear medications, especially for older people. For elderly parents, the time to clear medications might be longer because of age, decreased liver and kidney function. The body's not processing that and clearing toxins from the body. So anytime you add or discontinue medications, be very, very cautious. Take the appropriate time to discontinue one medication and begin another. Begin one at a time if you're adding more than one. And for some medical conditions, there's a term called titration. That is medical speak. That means that you're decreasing a medication or you're adding a medication. And for some medications, you can do it at the same time and not experience any adverse side effects. But again, do ask your doctor. This is a serious situation that can really result in great positive results or significant side effects. This is very obvious, but as we know, I think the numbers were 66% of Americans don't do this. Fill prescriptions for your elderly parents and follow the directions. Help your elderly parents fill and take their medications as prescribed. If the doctor prescribed a medication for you, the caregiver, fill it and take it as prescribed. It's not only the elderly. It's a lot of people who don't follow prescription recommendations. According to research, slightly 1/3, 31% of prescriptions are never filled. People under age, guess what age? 52, were less likely to fill their prescriptions than older people, and men were more slightly following through with these recommendations than women. As we discussed for adults 65 and older, one of the most common reasons for emergency room admissions is taking medications incorrectly. One of the easiest ways to manage medications for elderly parents is to set up medication reminder boxes. We'll talk more about these in another module. I actually will show you examples of different types of boxes that you can use. But here's the process. After picking up the medications, you can set up 1 or 2 weeks in a box that has morning and evening or morning, noon, evening, and bedtime slots, depending on the frequency your parents have to take medications. Then all your elderly parent really has to do is remember to walk over to that box, take the pills out of the slot, swallow them. If there's a problem with memory, there are electronic medications that have alarms. There are talking clocks with reminders. The more proactive you can be about learning how to manage medications for elderly parents, the fewer issues there will be with chronic health conditions that continue to get worse, that result in more doctor appointments, going to the hospital, and more time on your part devoted to managing health concerns. Also, very important, if you have two parents and they both take medications, make sure that your parents aren't accidentally taking each other's medications. I know it sounds like common sense, but you would be surprised how often this happens. Label the reminder boxes with mom or dad, or write your parents' names on them. Put them in different locations rather than sitting next to each other on the kitchen counter. Another thing to be aware of, and this comes into play when you are picking up new medications, is the pharmacy issues and formulary issues that cost money. So you want to make sure that when a physician prescribes medications, that medication is in your prescription insurance formulary. And what does that mean? So it means that it's an approved medication by your insurance company that usually has a very low copay. Physicians all the time will prescribe medications that aren't in your formulary. And what that means is you show up at the pharmacy and you have like a $500 bill. And you're thinking, oh my gosh, I can't even afford to get this filled. So a lot of times people won't say anything and they just don't get it filled. What you want to do if that happens is ask the pharmacist to call your physician and give another couple alternatives for that medication. The pharmacist then can run it through your insurance plan to see what might work. You can also, when you are at the doctor's office, ask the physician if he or she can confirm that the medication is within your health insurance plan. Always ask for the names of two alternative medications. You can also pick up the phone. You can call your insurance company before you leave your physician's office to confirm that the medication is in the formulary. That call to check with the insurance company might seem to be a time-consuming effort. However, I'll tell you, it'll save you time, money, frustration in the long run when you're having to spend hours at the pharmacy, having to run back and forth, trying to figure out what's paid for, what's not paid for. This is the way that we continue to learn more about how to manage medications for elderly parents. While some medications can go through a pre-authorization process, that can take up to a couple of weeks or more if that medication is not in the formulary. The easiest way to go is to have your doctor prescribe a medication that your insurance company pays for. Checking the formulary, it's part of advocating for the care of an elderly parent. A lot of individuals, like I said, they won't take a medication because of that copay, and they don't know that there's a less expensive option. Or some people worry about calling a health care insurance company to ask, thinking that it will be a hassle. Honestly, it can be a hassle, but what's more important? Your health, your well-being? Would you rather be in control of your health and know what's going on than leave it up to your insurance company or a pharmacy to scare you away from taking a medication that could be the solution to a lot of your health problems? And what I mean by this is one of the alternative medications may have a copay of $4. The other one may be $40 or $400. Put yourself in control, call your insurance company, work with your doctor, work with the pharmacy, which brings us to my next suggestion. Make that pharmacist your new best friend. When the person at the counter asks if you have questions about the medication, say absolutely yes. Pharmacists know more than most physicians about medications and contraindications, so side effects, allergic reactions based on your health history, foods that counteract with the medications. Pharmacists are very good at educating patients about medications, and they really enjoy talking to people. They enjoy this part of their work. If you or an elderly parent are concerned about taking medications, if you've had a bad experience with side effects, Make sure that you investigate other options with the pharmacist and your doctor. For some medical conditions and medications in the elderly, there could be over-the-counter options. Some individuals prefer to see a naturopath practitioner or an alternative provider to not have to take a prescription drug. Over the years, I've actually worked with a lot of compounding pharmacies that can really work magic. I'll share the benefits of compounding pharmacies, but you have to understand that some of these solutions may have a cost. Your insurance may not reimburse for these, so keep that in mind. The cost is the time really that it takes for you to investigate with your insurance company whether medication is paid for or not. And then you go to the compounding pharmacies and see what they can do for you. Some can replicate discontinued medications. Some can recreate ingredients of a medication that might not be accessible in liquid form. The goal of a lot of compounding pharmacies are to make medications that are either easier to take or easier to use. And this idea comes in really handy when working with elderly parents, children, or even your pets who may resist taking medication. Compounding pharmacists can create medications with flavors and in different forms. So, medications in patches, topical gels, liquids, flavored powders, and other forms. You don't really know what's possible until you ask. If you have a loved one who has sensitivities or allergies to dyes, lactose, gluten, or alcohol, a compounding pharmacy may be able to make a formula without those ingredients. Compounding pharmacies are a step further. They can also offer other advice and recommendations that regular pharmacies may not have access to or aren't aware of to solve medication issues for your elderly parent. Because they create products, compounding pharmacies can offer solutions that traditional medicine does not. When in doubt about solutions for medication side effects, allergies, discontinued medications, medications in easy-to-take forms, and other solutions, find a local compounding pharmacy and ask them. Having conversations with doctors about prescription drugs and supplements, so important when managing medications for your elderly parents. You also want to understand the health concerning issues so that you can learn how medications can improve conditions, so that you can also learn how medications can negatively impact through side effects the daily health and well-being of your elderly parent. Make medications something that you talk about medications frequently. Make sure that your elderly parents are getting them filled. Make sure that you are taking your medications. We all benefit from following health recommendations from doctors. Otherwise, why are we even going? Don't be in that 66% of consumers who don't take medications and who cause the healthcare system over $300 billion in unnecessary costs every year. I'm Pamela D Wilson. Thank you for being with me for this webinar. I will see you again in the next webinar.